Well, presenting the day 2, question number 2 of the INICET 7th of May revision video series program of orthopedics. Again, a question which I'm sure you all must have seen many times in the previous INI exams. A patient fell down from a height from his on his outstretched hand. X-ray is shown here. So, what do you think is the most likely diagnosis? See, I'll make it very simple for you. I'm sure you all can see this bone here. Okay, this bone here, that is basically ulna. This bone here is radius. You can see a fracture here. The fracture is not in the distal end of the radius. The fracture is in the shaft of the radius, not in middle one third of the shaft. This is exactly the junction of the middle one third and the distal one third. So there's a fracture of shaft of radius, not in the middle one third, but at the junction of middle and distal one third. Apart from this, I would want you to see that there is some problem here in the distal radial nerve joint. I don't see this is a normal distal radial nerve joint. No, this is not a normal drudge. The distal radial nerve joint has gone into dislocation. See how ulna is overlapping this, so joint has gone into dislocation. So technically, you have a fracture of the shaft of the radius at the junction of middle and distal one third with DRUJ dislocation, and this fracture is what is called as, come on, speak up everyone, Galeazzi's fracture. Okay, so this is basically Galeazzi's fracture. Now, had it been, Colles fracture, then it would have been a fracture of the distal end of the radius. It would have been an extra articular fracture, and it would have been a fracture with the dorsal displacement. So this is not a Colles fracture. Similarly, intra-articular fracture of base of first metacarpal. Okay, and that too, which is T-shaped or Y-shaped or V-shaped comminuted fracture. T-shaped, V-shaped, Y-shaped comminuted fracture. That is what is called as Rolando's fracture. It has nothing to do with it. Okay, answer is of course Galeazzi. We're just ruling out other option. Now Montegia. Montegia, as we all know, it is fracture of proximal one third of ulnar shaft. Okay, it is fracture of proximal one third of ulnar shaft plus radial head dislocation, and I do not see anything of that sort. So this is a clear cut Galeazzi fracture. Very frequently asked in INI, and stay tuned for more videos for this INICET 7th of May revision series. Thank you.